Howdy folks, Dr. Ed here with Total Body Healthcare, and I've got your Whiteboard Wednesday thought of the week. With all the information that we have available to us 24/7, many of the folks that come into me for help, they almost feel overwhelmed with what's wrong with them and where they need to start their healing journey. I can't tell you how many times I have heard, well, Dr. Ed, I was on Google last night, and then they go into this long explanation what they think's wrong with themselves. I've even had people come in here with a screenshot picture of a body part, and they say that's what's wrong, where their problem is. And then when I ask them to point on their body where it is, it's the exact opposite side. Like for instance, it's a screenshot of the back of the shoulder, and they're saying it's right there that's hurting me. And then I ask them to touch on there, and then they point to the front part of the shoulder. Happens all the time. And I get it. When you or your child are experiencing a health challenge, you want to get it fixed as quickly as possible. And you think Dr. Google might help. In my experience, though, those internet diagnosis conclusions only create more anxiety on the stress on the part of the patients or the parents. So with that being said, I want to give you some advice this week on Whiteboard Wednesday that will help you keep your health challenges to a minimum and begin the healing process once those health challenges start. This advice applies to infants and toddlers all the way up to senior citizens. If someone is not doing this properly or enough of it, I can guarantee you that they are not healthy and probably have loads of symptoms. So here's a mnemonic. I want you to remember this one major piece of advice. Movement matters most. When I say this to adults, they automatically think I'm telling them that exercise is the most important thing you can do, because if you're exercising, you're obviously moving, right? Well, yes, having a good, well-rounded fitness routine is one of the key factors to maintaining health, but it is actually not what I'm talking about today. If you think back to our pyramid of development that we've been discussing over the last several weeks, the foundational layer of that pyramid is the central and autonomic nervous system, because that's what controls all of the functions of your body. The next layer up is your motor nervous system, and that is actually where we're going to spend our time today. So let's take a look at what I mean by movement matters most at the various stages of life. One of the first things that we begin to look for with infants and toddlers is what's known as milestones. Movement milestones. Pardon the handwriting. I'm a doctor, so my handwriting has to be nasty. Movement milestones. Age birth to say about 3 months, they're swaddled up, they're being cuddled by their parents. There's not a whole lot of movement there. But then at 4 or 5 months, they start getting what we call tummy time. So the infant's laying on their belly. The first thing that they have to do is they have to start learning how to pick their head up and control those neck muscles and movement around. One of the first movement milestones is that tummy time and neck movement. Along with that neck movement, they begin more controlled eye movements, and that allows them to begin seeing and interacting with their environment a little bit more, as opposed to just their mother's face right there in front of them as they're breastfeeding. After the tummy time, the next little movement milestone is rolling over, and it's important that they go both directions, right side and left side. Crawling, another huge movement milestone, particularly the cross crawl method. There's a lot of neuronal connections taking place in the brain, having to coordinate the left side to the right side, or the left side to the right side. And of course, crawling then leads into walking. All of those are movements, if you think about it. Talking, for that matter. Think about how many muscles I am controlling right now just while I'm talking to you. Talking is a movement milestone in infants. In toddlers, if a child isn't reaching those movement milestones, they obviously are not healthy. That's when pediatricians and physical therapists and occupational therapists and chiropractors get involved. And it's most likely because of a breakdown in communication between the central and the motor nervous systems at the base of that developmental pyramid, like we talked about. Another area that movement is very, very important is our gut health. The movement of a food bolus, once we swallow our food, goes down the esophagus and starts its journey all the way down through. That movement is called peristalsis. Most people, maybe most people, I don't know if that's the right term or not. A lot of people may not realize that your gut wall is lined with muscles, and those muscles have to contract and relax to move those food particles down through your esophagus, into your stomach, into your small intestine, out through your large intestine. That peristaltic movement is controlled by those muscles in the gut wall. We all know, I guarantee you, we all know what a lack of movement in our gut feels like. It's actually one of the top reasons why kids see a chiropractor for health issues and for gut health issues. I see it a lot in the little kids that I take care of here. A third area that movement matters most is in our immune system. A lot of folks don't necessarily realize that the immune system absolutely needs movement. I mean, just think about it logically. This is something that we all know, that if we have an older bedridden adult, what is the one big concern that we have about for them? Pneumonia, right? Because they're not moving, that fluid builds up in the lungs. The immune system can't take care of that because of that lack of movement. Coughing, runny nose from viral challenges, that's the body's way of moving those pathogens up and out of the body. Our lymphatic system, part of the immune system, removes toxins from our tissues, and it relies totally on our daily movements to work correctly. So the immune system, movement matters most. The fourth one, and honestly, I probably should have started with this one, but it's what we take care of here in the office every single day, the subluxation. One of the key components to a subluxation is what's a kind of a big scientific word, a little on the nerdy side. It's called dyskinesis. Dyskinesis is a lack of or improper movement of the joints of the spine. So when a subluxation implies the misalignment of at least one of the vertebrae, when that happens, that creates the lack of or improper movement of those joints. That's what we call dyskinesis. That's important because over 90% of the brain's neurologic, they actually call it neurologic nutrition, comes from the movement of the spine. In other words, the brain has to be able to feel the spine moving correctly. One of the key components that we check on with patients when a new patient starts in here is their EMG, electromyography. What that tells me when we do that on our scan is it tells us what their muscle patterns look like alongside the spine. If the spine is misaligned, if it is subluxated, it's not moving correctly, the muscles then over time will have to work harder in that area, and we call that muscle spasms. Muscle spasms that stay in there for an extended period of time then become fatigued muscles because they've been in spasm for so long, they're now fatigued. Fatigued muscles are the muscles that then become injured. So subluxations are a key part of remembering that movement matters most. Another one that we need to think about is what we call a sedentary lifestyle. What is a sedentary lifestyle? I know we've all heard of it, but what is a sedentary lifestyle? It's actually defined as lack of movement for more than 8 hours a day. You may be thinking, wow, 8 hours a day, but if you think about it, that's a normal work day. People do sit for more than 8 hours a day. Here's the kicker. According to the U.S. Surgeon General, a sedentary lifestyle, sitting for more than 8 hours a day, is now more deadly than smoking a pack of cigarettes a day. I'm not telling you it's okay to go smoke cigarettes. I'm not saying that at all. What I'm saying is we need to be moving. What I see here in the office clinically, a lot of patients will come in here and they say, oh, it was a work injury or something like that because I've got such a physically demanding job. They're lifting, they're moving, they're twisting. Here's what I know, and this is from 27 years of clinical experience. If I were to have two patients with very similar injuries, one has a physically demanding job, one has a very sedentary job, the physically demanding job person is going to get better quicker because they're moving and they're used to moving. The sedentary lifestyle is one of the biggest issues with a lot of our health these days. Movement matters most with sedentary lifestyle. Finally, kind of towards the end of our life, one of the big things that we always want to work on is our balance and flexibility. Flexibility, yeah, there's an L in there. Like I said, bad handwriting. That's one of the key things that we look for in older adults. I even test some of them with balance when they come into the office here. Losing our balance and flexibility is not part of the normal aging process. We all know senior citizens who move around like just graceful ballerinas. And then we also know folks that are in their mid 50s that they move like a three-toed sloth. It's not part of the normal aging process. The graceful ballerina, that person has been moving all throughout their lives, and their body is used to it and has been able to sustain their balance and flexibility. So the one key component all of these 6 stages have in common is clear communication between the central and motor nervous systems in the body. Interference in that communication is what we talked about in step 4. It's called a subluxation. A subluxation is a breakdown in the communication between the motor nervous system in the lower part of the body and the central nervous system. This can affect a child's milestone development markers. A subluxation can affect your gut health by not controlling that peristaltic activity correctly. It affects your immune system by not allowing not moving the correct antibodies and T cells and lymphocytes into the sick, affected area of the body. This central nervous system controlling and communicating with the motor nervous system is vital for our movement mattering most health. Regular chiropractic care can help your body move better and therefore interact with your environment more effectively and help you be healthy. Not sure if chiropractic care can help you or your child? Well, feel free to shoot me a direct message or shoot me an email and just ask. Better yet, call the office and schedule an appointment so we can discuss it in person. I'm Dr. Ed with Total Body Healthcare, and there's your Whiteboard Wednesday Thought of the Week.